Hey, thanks so much, Mariah. Hi, everybody. My name is Dale White. I also work with Boulder County Housing and Human Services and the Health Coverage Enrollment Center. So I'm here to share with you what services we provide. And I'm going to start out by saying we're certified as an enrollment center by Connect for Health Colorado, Colorado's marketplace. So this is the part of the Affordable Care Act that spans insurance affordability programs. And Connect for Health Colorado is where people can apply for and receive financial assistance to purchase private health insurance. So Medicaid and Medicare are on the public side. Connect for Health Colorado is on the private side. It's quasi-governmental, but it connects people to plans through private carriers. But people can apply for and receive financial assistance, commonly referred to as APTC, which is Advanced Premium Tax Credits or Cost Sharing Reductions. But in short, it's a way to really lower their costs for health coverage. And we'll go into that just a little bit more as we go along. But we've been around since 2013, and this slide depicts what we do. So it's really all the way from understanding health insurance, which, as most of us know, can be really very complicated, and especially for people that are pretty new to insurance. There's a lot of terminology. There's a lot to try to understand, to shop for and purchase one's own plan. We move people all the way through the enrollment process, help them know how to use it, help them stay enrolled through reporting changes, and then also what to expect come tax time, because the premium tax credits are all tied up also with tax filing. Next slide, please. So that's our contact information. It'll be again at the end of the slide. We have appointments available by phone or video conferencing. So we've gone virtual, like lots and lots and lots of places, and we're going to be operating, we think, Monday through Friday, between the hours of 8:30 and 6 p.m. So we're looking to have some extended hours. The virtual world is allowing us some more flexibility with that than we had previously in our buildings, so that we can accommodate people that might need some time after like normal work hours. And so we schedule appointments, but people can also just call in and kind of have a drop in if we have an available health coverage guide. We're also going to be offering those same kind of services with some shortened hours on 3 Saturdays, December 5th, 12th, and then also January 9th. And for those that need some special assistance and phone or virtual just really isn't going to work for them, we will be able to accommodate limited in-person appointments, and that's more likely than not going to be at our Boulder site, 3460 Broadway, but that'll be at the end on the last slide. So open enrollment for shopping in the marketplace is different than Medicare open enrollment. This open enrollment period is November 1st, coming up in 2 weeks, to January 15th, and that's every year in Colorado all the time. And that can be different than the federal marketplace. Colorado has its own. These are our standard open enrollment dates, and that's the period during which people can buy new or change their existing plans. Outside of that time frame, they have to have what are called like qualifying events, kind of big things happen in their life that would allow them to change their plans or shop for new plans, add a family member, whatever it might be. But otherwise, it's just during this time frame during open enrollment. If people enroll by December 15th, if people enroll by December 15th, then their coverage will start January 1st. If they enroll after December 16th to the 30th or into January, it'll start in February. That's that. Now you can go forward, Daphne. Thank you. Okay, so here's some of the data that Patrick spoke to at the beginning, but just to show you the numbers, and part of it is that I want to really kind of speak to the uninsured people in Boulder County in hopes that sending this message out through all of you will help us get to those people. And I want to just preface this by saying all of these numbers are pre-pandemic. And so the folks that have gotten enrolled in Medicaid, yay, great, that's awesome. But there might also be people that are not eligible for Medicaid that could be eligible for the financial assistance through the marketplace, depending on the different eligibility requirements. So we just want to do the best we can to try to keep and or get everybody insured, especially during the pandemic. So of the almost 20,000 people thereabouts that are uninsured in Boulder County, I want to highlight that a pretty high percentage of that group are young. They're 19 to 34. And we also see that there's a high percentage, 35% are eligible but not enrolled in the tax credits that are available to them. And I'm going to show you some, I think, hopefully kind of interesting charts that you can see where they live. We've got almost 25% are Hispanic, Latino, and in Longmont, Lafayette, and Louisville. So that's one of the places we want to try to help spread the word as best we can. And there are those that are not citizens, but may still be eligible for tax credits because they're lawfully permanent residents. And that can be under the not with any 5-year bar. So there's some details and some nuances here. That's our area of expertise, but we want to at least provide some of this foundational information. Next slide. All right, so here's what we know. I want these zip codes so that you can look at your organization and the populations that you serve. Who are you working with? All of those red zip codes, we have somewhere between 40 to 100% of those populations are eligible for APTC. They're eligible for advanced premium tax credits, and they're not insured. All right, so 40 to 100% of the uninsured in that area, not the total population. And the majority of those are 18 to 44. So again, skewing young. In the yellow box, a different piece to really highlight is that 40 to 100% of the uninsured are actually, 40% of the population are actually enrolled in marketplace insurance. They're paying for private plans, and they're eligible for tax credits that they're not getting. So there's, two different messages to send out here. One is be insured, and the other is access all the financial assistance that's available to you. So next slide, we're going to go show you what that looks like a little bit. So this is a simple graphic that's merging Medicaid eligibility with marketplace eligibility on a threshold level. Medicaid is determined monthly, so this is just for comparative purposes, but so you can get an idea of the financial thresholds under which people would be eligible for these programs. So you can see at the bottom of the chart in the green are kind of the Health First Colorado thresholds, and then in the middle, and they blend together, we've got the cost sharing reductions along with Child Health Plan Plus, which goes up to about 260% FPL. So those gray boxes give you the idea of the amount of income that families of those sizes can earn and still be eligible for those programs or cost sharing reductions. And then on the top, and one more, sorry. And in the top in the orange boxes, you'll see that that's the range up to which people can be eligible for the advanced premium tax credits. So it's a much higher range, obviously, than Health First Colorado. And I just wanted to really highlight that there's a lot of people eligible for those tax credits that aren't getting them. Next slide. This shows you what that could look like. So the blue bar is the average statewide financially assisted premium cost. All right. So the people that are getting the tax credits let's look at 2019. Go over to 2019 there to the far right side. In 2019, the people that were receiving tax credits on average across the whole state were paying $118 a month for their premium, compared to the people that did not get any financial assistance paying over $500 a month for their premium. And then you see what that looked like in 2020. So this is, again, really averaging, but there are people that can get a lot of assistance to pay their premiums and end up with coverage for a pretty low monthly expense. And we just really, really want to highlight that information. Next slide. All right, so that's what we had for you. We want to remind everybody that we are here to help. And like the Medicare counselors, we're free and unbiased. It's a free service. We help people navigate, apply, and in the full spectrum of insurance affordability programs. Our our focus is on Connect for Health financial assistance, but we really support the complicated families. There are families that are in Medicaid, Child Health Plan Plus, and have advanced premium tax credits, and we can help them navigate across this ecosystem of health coverage. There's our contact information. And